Good morning. This is Terry Kuti, founder and director of Deep Sea Foundation. I'd like to welcome you to the educational channel where we talk about all topics related to breast reconstruction. Our guests this morning are Dr. James Craigie and Richard Klein from the Center for Natural Breast Reconstruction in the beautiful city of Charleston, South Carolina. They are board certified plastic surgeons and they perform all types of breast reconstruction, but they have a specialized training in microsurgery, and so they have a real specialty for tissue reconstruction. So I'd like to welcome you both to the program this morning.
Thank you.
Thank you, Terry.
Yeah, it's great to see you guys. How's everything going? We're filming this in the time of the pandemic, and I know that you guys are continuing to do your work and do virtual consults. So we'll do another video on that. But are you both doing well?
Yeah, they slowed us down for about a month in April, but we've been going full steam since then.
Yeah, we're very fortunate, back to kind of normal type work.
Excellent to hear. Well, I have a topic this morning that I really want to discuss with both of you, because when I was looking for surgeons for my DIEP flap, which was, almost 5.5 years ago now, part of the criterion for me really was to find a practice that had surgeons that work together. So what I'd like for you to talk about this morning is just briefly how you met, why you decided to start working together, and what really the value of that is for patients, because it was one of the top things on my list. So I don't know who wants to start out that conversation, but I'm very, very curious about your practice.
Maybe I'll start because I'm older than James and I'm remember more history. As you know, Robert Allen is the godfather of perforator flap breast reconstruction, and I had the privilege of being his plastic surgery resident 1990 through 92, before he'd ever even thought about perforator flaps. But even back then, as a new resident, the first thing he taught us was every microvascular flap is at least a 2 attending surgery, and that's the way we were raised up. I subsequently became his partner for a few years at LSU in New Orleans, during which time I had the great fortune to watch him develop the DIEP flap and the gap flap. And so the team approach applies even more to perforator flaps because they're just much more difficult than the other kinds of free flaps. When I moved, I'm from Charleston. When I moved back here in '96, I went for a few years to the Medical University of South Carolina, and Dr. Craigie was my resident. And interestingly, during that time, I did what we believe is the first DIEP flap done in the southeastern United States. Dr. Craigie just happened to be my resident on that case, and neither of us had any idea that we would have this huge practice doing nothing else. But I went into private practice in 2000, and shortly after asked Dr. Craigie to come join me. He did a fellowship with Dr. Allen. And so we're basically off and running. We have 2 people trained by, I'm going to call him the old master. I don't think he would mind. And the demand for microvascular reconstruction is so huge, we found ourselves doing basically nothing else.
This is so, I love this story because I saw you, Dr. Craigie, at the microvascular conference in January of this year of 2020, which seems like a lifetime ago now with everything that's gone on. But I got to meet Dr. Allen, and I agree with you. He is a revered old master in this. Why? His name is synonymous with DIEPs. Go ahead. This is great story, Dr. Klein.
Well, there's not a whole lot more to it in terms of how we got to be so busy. But when you look at, well, I'll tell you another interesting little story. So in the mid 90s, when Dr. Allen was developing this, there was a general surgery resident, a lady who was interested in plastic surgery, and her husband, this is in the mid-90s, was a web designer when a lot of people didn't know what a web designer was.
Yeah.
And he developed for Dr. Allen a website and that people could go to and find out the DIEP flap existed. And people literally started beating a path to his door. This wasn't a result of high pressure marketing, just the intrinsic appeal of be reconstructed with your own tissue and save your muscle is such a basic innate thing that people started beating a path to New Orleans. And before long, he was up to like 700 flaps. And everybody was like scratching their heads. Where are all these patients coming from? And it was just the power of the internet and the intrinsic appeal of the operation. So it's just another interesting little anecdote, I think, that sort of helped this whole thing to blossom.
Wow.
And when we went into practice here, you know, we by then everybody knew about the internet, but it's just tremendously valuable because in the great cadre of women who get breast cancer, some women don't particularly care about reconstruction, and that's fine, but some are very, very interested in it. And we're fortunate the internet allows them to look and see what's out there.
By the way, just so you guys know, it says Gail Lanter. If you call the Center for Natural Breast Reconstruction, that's who you are likely to get. She is their wonderful office administrator. I call her the boss. She is so quick to respond either via your website or online. So that's why you're seeing Gail, the name over there for Dr. Craigie and Klein. So Dr. Craigie, speak to us about the value of this team approach. It was, like I said, so important to me.
Yeah, and like Dr. Klein mentioned, that's the way we were trained. We were told from the beginning that's the way it should be done. And you know, as we began to practice together, it was obvious that many advantages. And a lot of plastic surgeons don't work with other surgeons. They might be solo practice. They may do surgery on their own, but microsurgery is unique in that way. And so what you get is two surgeons with their own experience, training, and expertise that can collaborate. And so you can always do better when you collaborate with someone else. Two heads are better than one. And yes, we can do all parts of the surgery, and that's the way it works. When it's his patient, then I do a certain set of tasks during the surgery that the assistant does. And then vice versa, when it's my patient, he does the same. And so we bring our perspective to each part of those surgeries each time. And so over time, we work together. We know what each other is thinking, and so it becomes more efficient. We can also solve problems together. Two heads are better than one. And so eventually what happens is you work together, it becomes seamless. There's literally hundreds of things that need to be done just so. And after doing it year after year and trying to always get better, then you realize that you're improving as you go. And you can't do that by yourself. There are times when there are challenges, and when you have someone there that's a microsurgeon, you know, that's when it becomes very, very important. And 90% of the time, surgeries kind of are routine, or things go the way we expect them. But there are always curveballs, and we want to be ready for that. And so that's the team is very important.
Yeah, I think James has really touched on something important. We've done between 1,900 and 2,000 perforator flaps for breast reconstruction. And I don't recall the most up-to-date numbers, but around 1,600 are DIEPs, around 300 are gaps from the buttock. Last time we looked at our statistics, our DIEP survival rate was 99.01%. The gap, which is a much, much harder operation, the survival rate is 95%. Because we have two surgeons, when we do have the rare problem, we have a safety valve. let's say we're doing a flap, and this very rarely happens, but a flap has a problem that we did 2 days ago. Well, one guy can break out and take care of it. So we would not have those flap survival rates, absolutely unequivocally not, if we didn't have 2 microsurgeons who were equally skilled at dealing with everything. The other great part about having 2 surgeons is it allows us to do simultaneous bilateral gap flaps, both breasts at the same time using the buttocks, which is the most difficult operation, one of the most difficult in plastic surgery. And we've done over 100 simultaneous bilateral, but there's absolutely no way on earth that could be done without 2 microsurgeons working simultaneously, because the gap flap harvest takes 3 to 5 hours. So you have to have one surgeon dissecting each side at the same time. And they're stressful, but it's usually a very happy operation. And we're pleased to be able to offer that to patients as well on a routine basis.
And you want the 2 sides to come out and look, being similar for symmetry. And so having done it over and over again, and planning surgeries, and that really helps.
The words that you all are using to describe your practice are the very vocabulary that I encourage patients to discuss with their surgeons. Success rate. What is that? How many flaps have you done? What kind of flaps do you do? Do you work with a team? All of these things are very important questions for patients to communicate at their consult. So here's the other thing I noticed. Just sitting here listening and talking to both of you, because of your high success rate, because of your teamwork, what you're doing and what you are reflecting for patients is your confidence. That means a lot to patients. I think patients generally know when they sit in a consult how comfortable their surgeons are. And also it's part of that shared decision-making process that we talk about as patients. So to engage your patients, your clients, so to speak, in all of these conversations that you just had with me is so important to optimal patient outcomes. And, let's face it, surgery is surgery. We're going to have complications sometimes. I always say the mark of a successful breast reconstruction is, even when there are complications, the surgeons, even when there's complications, see you all the way through. And, the fact that you guys mentioned earlier that, let's say that, I think that Dr. Craigie, you brought this up. Let's say that something happens, 1 or 2 days down the road, you've got the other one to back up. You've got your partner there to back up. All these things are so, so very important, especially, like you said, in a microsurgical team.
Right. And one other thing, this isn't part of the necessarily to team approach, but I think it's critically important. This isn't the kind of surgery we ever try to sell. And we wouldn't want to operate on people who didn't know what they're getting into. So one of the nice things about having people come from out of town is we know they've done their homework, they know what they're getting into. But I view the consultation, the initial consultation, is I am trying to educate the patient to the point where they are a knowledgeable partner in this entire process and are able to make decisions that suit them the best, because it's not one operation, it's a process. It could easily take a year in some cases, and a lot of our patients end up seeming like family by the time we're done with them. But education of the patients for surgery this complicated is absolutely critical to having the best possible results.
Well, you hit on my key word, education. I want to thank you both really for being on the program this morning. This was such valuable information. and we'll have all of your information at the end of this video. For the viewers, if you have any questions or comments on this video, if you have any suggestions for further topics, please let us know. You know, Dr. Craigie and Klein have both engaged in a great amount of educating patients, and I just want to thank you both for that, because that's an important part of this process. So thank you both for being on the program today. I appreciate it, and it's great to see you both.
Thank you.
Thank you for
Good to
having
see
us.
you.
All right.
Great day.
You too, and take care.